So, in this lecture, we're moving from career and employment assessment into personality assessment. Personality assessment is one of those topics that tends to pull people in quickly because most of us are naturally curious about personality. We want to understand ourselves, we want to understand other people, and we want language for why we do what we do, why relationships feel the way they feel, why some environments bring out the best of us, why other environments make us want to crawl out of our skin. This is part of why tools like the MBTI and Enneagram are so popular. People like seeing themselves reflected back in a framework. It can feel validating, it can give language to patterns that were hard to name before. But this is where we also have to be careful. A personality assessment can help us ask better questions, but it can also become harmful if we treat those results like identity, diagnosis, or destiny. So today, our guiding question is this: how can counselors use personality assessment to deepen curiosity without shrinking the client? That's the balance that we're going to hold through this lecture. Personality tools can be useful, they can help clients reflect, they can help counselors organize information, they can support treatment planning, self awareness, and discussion of strengths and growth areas. But they can also oversimplify people, ignore culture and context, confuse temporary distress with personality, or lead counselors to overbelieve a label. So, we're going to talk about both sides: what personality assessment can offer and what can go wrong when we use it carefully. Personality assessment may help counselors explore patterns in how people tend to think, feel, behave, relate, cope, make decisions, and respond to stress. In counseling, that can be useful. For example, a client might repeatedly avoid conflict, overfunction in relationships, withdraw when distressed, seek reassurance, intellectualize emotion, or take responsibility for everyone else in the room. Those patterns matter clinically, and they shape how the client experiences symptoms. They may shape how the client builds trust, or how they respond to feedback, homework, confrontation, support, silence, structure, and vulnerability. Personality assessment can give us language for some of those patterns. But here's the catch: personality assessment is not mind reading. It doesn't tell us who a person is at their core, it doesn't explain every behavior, it does not replace clinical judgment. It doesn't tell us what trauma, grief, oppression, culture, family system, substance use, medical issues, or developmental stage may be contributing to the client's presentation. So in counseling, we are not asking, what type is this person? We're asking, what does this information help us understand and what does it leave out? And that question is key. If a client brings in MBTI results, Enneagram results, or results from a more formal personality inventory, maybe like a DISC inventory, our job is not to accept the profile at face value. Our job is to work with the client to explore fit, limits, meaning, and context. Personality assessment should support curiosity. It should not become a shortcut. So before we talk about personality tests, we need to talk about what we mean by personality. Personality is often described as a relatively stable pattern in how a person tends to think, feel, relate, cope, and generally move through the world. And that sounds simple enough, but personality is actually hard to measure because different theories define personality differently. Some theories focus on traits, some focus on types, some focus on unconscious process, some focus on interpersonal patterns, some focus on motivation, some focus on temperament, some focus on how people adapt to their environments. And that matters because every personality assessment is built on assumptions. The Big Five measure assumes personality can be understood through broad dimensions like openness, conscientiousness, extroversion, agreeableness, and neuroticism. The MBTI assumes that people can be described through preferences related to energy, information, decision-making, and orientation to the outside world. The Myers-Briggs Company describes the MBTI as identifying preferences in those four areas: introversion or extroversion, sensing or intuition, thinking or feeling, and judging or perceiving. And the Enneagram focuses more on motivation, fears, defenses, and growth patterns. The MMPI family of instruments focuses more on clinical symptoms, personality, psychopathy, and response style. So before we ask, is this personality test accurate, we should ask, what version of personality is this test trying to measure? That question keeps us from treating all personality tools as if they're doing the same job, because they are not. Some are clinical instruments, some are self-awareness tools, some are used in organizational settings, some are even research-based, and some are popular because they feel personally meaningful, even when their scientific support is limited. As counselors, we need to know the difference. So trait, state, and type. This is one of the most important ideas in this lecture. A trait is a relatively stable tendency across time and situations. For example, a person may tend to be cautious, warm, conscientious, curious, assertive, emotionally reactive, or maybe organized across many settings. A state is temporary and influenced by context. So for example, panic, grief, depression, intoxication, trauma activation, burnout, sleep deprivation, or acute stress can all affect how a person answers questions or behaves in a session. And then a type is a category-based description. For example, ENFJ, INFP, type 2, type 4, type 6. This distinction matters because clients often take personality results very personally. They may say, this is just who I am. But sometimes what they're describing is not personality. Sometimes it's distress. Sometimes it's adaptation. Sometimes it's survival. Let's use Ted Lasso as an example. Ted may have a warm, relational, helper-oriented pattern. That might be a trait-like pattern. He tends to notice others, support others, encourage others, and build morale. But his panic attacks are not simply his personality. They are also connected to state of context: divorce, relocation, public pressure, emotional avoidance, and grief. If we flatten all of that into Ted is an ENFJ or Ted is a type 2, we're going to miss a lot. Same with Rue Bennett. If we say Rue is an INFP or type 4, we might capture some of the themes of internal processing, identity, emotional intensity, or disconnection. But if we stop there, we miss depression, substance use, trauma, adolescence, family context, and neurobiology. Same with Miles Morales. ENFP or type 6 might capture creativity, possibility, loyalty, anxiety, or self-doubt. But that doesn't fully explain cultural identity, family expectations, school pressure, adolescence, or the weight of becoming Spider-Man. So as you think about personality assessment, keep asking, is this a trait, a state, a type, or is it context? Because that question can save you from over-interpreting a test result. So trait-based tools can be useful when they help us notice patterns. They can help clients develop shared language for how they tend to respond to stress, relationships, decision-making, conflict, structure, ambiguity, and emotion. For example, a client might say, I always thought I was lazy, but maybe I actually shut down when I feel overwhelmed. Or, I thought I was being helpful, but maybe I was using helpful to avoid feeling vulnerable. Or, I keep choosing jobs that look impressive, but ignore whether the environment actually fits with how I function. Personality language can open meaningful conversations. It can also help with treatment planning. A client who tends to intellectualize may need help contacting emotion in the room. A client who tends to people please may need support with boundaries and needs. A client who tends to withdraw may need pacing, safety, and relationship building before deeper emotional work. A client who tends to seek reassurance may need support developing internal confidence and tolerating uncertainty. But trait language should support curiosity, not lock the client into a label. Think about Leslie Knope from Parks and Rec. We would describe her as organized, driven, service-oriented, enthusiastic, and highly invested in civic life. And that may help us understand some of her patterns. But it does not explain everything. Under stress, disappointment, conflict, exhaustion, or loss, those same traits may show up differently. Her drive might become rigidity. Her care might become control. Her optimism might become avoidance of painful reality. So that's how personality works in real life. Traits interact with context, so the value of trait-based assessment is not that it gives us a final explanation. It gives us a starting point. Structured personality inventories usually ask clients to respond to fixed items. Those items might be true, false, multiple choice, Likert scale, or forced choice. Examples include the MMPI 3, MCM 4, NEO inventories, 16PF, CPI, MBTI, and Enneagram-based tools, depending on the version being used. And the word structured matters. It means that the test is administered and scored in a standardized way. Everyone receives the same items or a controlled set of items, and the scores are calculated according to a set system. But structured does not mean perfect. It does not mean the tool is valid for every client, every culture, every purpose, or every setting. It also does not mean that interpretation is simple. The MMPI 3, for example, is very different from a casual online personality quiz. It's a clinical instrument with validity scales, clinical scales, and professional requirements for interpretation. The University of Minnesota Press described the MMPI 3 as a 335-item instrument with updated items and scales, new English and Spanish language norms, and use in mental health, medical, forensic, and public safety settings. That is very different from somebody taking a free online Enneagram quiz and saying, I'm a 4, so this explains my depression. Both may involve personality language, but they are not doing the same thing. So when we hear personality assessment, we always need to ask, what tool, for what purpose, with what evidence, used by whom, interpreted how, and with what possible risk? So the MMPI 3 is one of the places that we need to update the textbook conversation. The MMPI has been one of the best-known personality assessment instruments in psychological assessment for decades. Many students hear personality test and think of something like the MBTI, but the MMPI family is more clinical and much higher stakes. The MMPI 3 was published in 2020. Again, it includes 335 true-false items, takes about 35 to 50 minutes to administer, and is intended for adults 18 and over. It also includes updated norms designed to match United States Census demographic projections for 2020. This matters because assessment tools are not frozen in time. Norms age, language changes, research changes, populations change, diagnostic frameworks change, and if we use older tools without awareness of updates, we may miss important changes in the field. The MMPI-3 also includes validity scales, which helps assess response patterns. That is important because in personality assessment, we are never only asking, what did the client endorse? We're also asking, how did the client respond? Were they consistent? Were they exaggerating symptoms, minimizing distress, randomly responding, presenting themselves as unusually virtuous, or maybe trying to look healthier than they feel or trying to look more impaired? That does not mean that we assume clients are lying. It means that we recognize that test taking is human behavior. People respond from fear, shame, confusion, guardedness, anger, fatigue, mistrust, or a desire to be seen. So the MMPI-3 gives us a good reminder. Higher stakes personality assessment requires training, careful interpretation, and attention to response style. This is not a BuzzFeed quiz. This is not which Shrek character are you? This is a clinical assessment, and those are very different things. So now let's talk about the MBTI. The MBTI is everywhere. People talk about it in workplaces, relationships, social media, dating profiles, leadership trainings, and fandom spaces. It can be fun. It can also be useful as shared language. Myers-Briggs Company describes the MBTI as a tool for self-awareness, communication, collaboration, and understanding personality preferences. It identifies preferences related to energy, information, decision-making, and approach to outside world. That is the appropriate lane for MBTI: self-awareness, reflection, communication, and development. But the MBTI also has serious limitations. Even the official Myers-Briggs source states that the MBTI should never be used in recruitment or selection because it does not measure skills or abilities, and is not considered to predict behavior, and is not designed as a selection tool. So that's a really big deal. If the tool's own publisher says not to use it for hiring or selection, counselors should be very careful about using it in high-stakes ways. In counseling, the MBTI might help a client reflect on preferences. It might give a language for how they tend to recharge, gather information, make decisions, or structure their life. But it should not be used to diagnose. It should not be used to predict behavior with false confidence. It should not be used to tell somebody what career they should choose. It should not be used to explain away symptoms or reduce a client to 4 letters. For example, saying that Ted Lasso has ENFJ energy might help us understand his relational focus, encouragement of others, values-based leadership, and emotional attunement. But if Ted is having panic attacks, we do not stop at ENFJ. We ask about stress, loss, divorce, avoidance, attachment, culture, masculinity, loneliness, sleep, support, and whether his constant care for others has become a way to avoid his own pain. That's the difference between personality language and counseling. Personality language can start the conversation. Counseling has to deepen it. And the Enneagram is another widely used personality framework. Many people like it because it feels deeper than surface behavior. It focuses on motivation, fear, defenses, identity, and growth. For example, type 2 is often described around helping, being needed, and seeking connection through care. Type 4 is often described around identity, emotional intensity, longing, and feeling different. Type 6 is often described around safety, loyalty, doubt, and seeking guidance for certainty. You can see why this framework feels useful in counseling conversation. It gives people language for what drives them, not just what they do. But we need to hold it carefully. The Enneagram is not a diagnostic tool. It's not designed to predict behavior. It does not replace clinical assessment. It's not enough to explain depression, trauma, substance use, anxiety, personality disorders, attachment patterns, or identity development, or a million other things. It can also create confirmation bias. And confirmation bias means that we notice the things that fit the label and ignore the things that do not. If I decide Rue Bennett is a type 4, I might start noticing her emotional intensity, withdrawal, identity struggle, and sense of disconnection. Those observations may be useful, but if I stop there, I may miss the bigger clinical picture: substance use, depression, grief, family strain, possible trauma, adolescent development, and ambivalence towards treatment, and that's the danger. A framework can give language, but it can also narrow our vision. So with Enneagram, I would use a phrase like this: this may be a helpful reflection tool, but it's not enough information to understand the client clinically. That's the stance that we want. Curious, but not captured. Now, let's shift into a more research-grounded way of thinking about personality: dimensional trait models. One of the most common is the 5-factor model, often remembered as OCEAN: openness, conscientiousness, extroversion, agreeableness, and neuroticism. And this model is different from type-based systems. Instead of saying, you are this type of person, dimensional models ask where somebody tends to fall along broad continua. So rather than saying somebody is an introvert or an extrovert as a fixed category, we might think about degrees of extroversion. Rather than saying somebody is emotionally intense as a type, we might think about neuroticism or negative emotionality as trait dimensions. And this matters because real people do not always fit in clean little boxes. A person may be outgoing at work and private at home. A person may be highly organized in caregiving, but scattered with personal tasks. A person may be emotionally steady in crisis, but anxious in relationships. A person may be creative and open in art, but rigid in family expectations. Dimensional models can leave more room for variation, and they also remind us that personality is not all or nothing. This is one of the concerns with the type-based tools like MBTI and Enneagram. Type systems can feel satisfying because they give a clean answer, but people really aren't that clean. In counseling, we need room for contradiction, context, growth, culture, and stress. And a client can have a stable personality pattern and still surprise us. So let's do a quick pop culture check with the 3 fictional clients that we're thinking about this week: Ted Lasso, Rue Bennett, Miles Morales. Ted Lasso might be described as an ENFJ and Enneagram type 2. That captures something about him: warmth, connection, care for others, and identity tied to being supportive. But it does not explain everything. It definitely doesn't explain his panic attacks. It doesn't explain divorce, grief, relocation, his love for emotional avoidance, or the pressure of being the person that everybody else leans on. Rue could be described as an INFP and Enneagram type 4, and that captures emotional depth, identity struggles, withdrawal, and sense of disconnection, but leaves out substance use, depression, adolescence, family dynamics, grief, trauma, neurobiology, and ambivalence. Miles could be an ENFP and an Enneagram type 6, and that captures his creativity, energy, possibility, along with self-doubt, loyalty, and search for guidance. But Miles is also an adolescent navigating school pressure, family expectations, cultural identity, mentor relationships, and a whole new role that he doesn't feel ready to carry yet. So here's the takeaway. Personality language can describe patterns, but it should not replace case conceptualization. That's the skill. Don't only ask, does this type fit? Ask, what fits? What's helpful? What's missing? What might be a state rather than a trait? What else do we need to assess? What could go wrong if we overbelieve the result? And those are all really good counselor questions. So now let's talk about projective approaches. Projective techniques use ambiguous stimuli or open-ended tasks to invite responses that may reveal themes, conflicts, perceptions, needs, relational patterns, or ways of making meaning. Examples include the Rorschach inkblot test, thematic apperception test or TAT, sentence completion tasks, draw a person, kinetic family drawing, choice arrangement tasks, play-based or storytelling approaches. And the idea behind projective techniques is that when people respond to ambiguous material, they may bring forward parts of their internal world. For example, if somebody is shown an image and asked to tell a story about what is happening, they may reveal themes of danger, care, abandonment, hope, control, shame, rescue, power, or loss. And that can all be really clinically rich. But it also requires a huge amount of caution. Projective material is not self-interpreting. If a client tells a dark story, that does not automatically mean they are dangerous or depressed. If a child draws a small figure, that does not automatically mean low self-esteem. If somebody leaves out hands in a drawing, that does not automatically mean powerlessness. If somebody sees something violent in an ink blot, that does not automatically tell us who they are. Projective material can open a conversation, but should not become a magic decoder ring. And because many counselors are drawn to expressive or creative work, we need to be especially careful here. Creative material belongs to the client. We do not get to impose meaning on it. We can ask, we can wonder, we can explore, we can notice patterns over time, but we do not declare meaning as if we have secret access to the client's unconscious. So let's stay with that issue for a minute. Overinterpretation is one of the biggest risks in personality assessment, especially with projective and expressive methods. Overinterpretation happens when we make a bigger conclusion than the evidence supports. A client draws with dark colors and the counselor says, this means depression. A client tells a story about conflict and the counselor says, this means family trauma. And a client chooses an aggressive image and the counselor says, this means the client has violent impulses. That's bad assessment. It's also harmful counseling. Clients deserve humility from us. Better responses might sound like, I noticed the image has a lot of dark shading. What does that feel connected to for you? Or, the story that you created seems to have a lot of danger and rescue in it. Does that theme show up anywhere else in your life? Or, I'm curious about what this part of the drawing means to you. Notice the difference. We are not imposing meaning, we are inviting meaning. Projective techniques may be useful when they're used by trained professionals with appropriate purpose and with attention to culture and context. But they may become risky when counselors treat symbols as universal. A snake does not mean the same thing in every culture. The color white does not mean the same thing in every culture. A small figure does not mean the same thing for every client. Silence does not mean the same thing in every family. Eye contact does not mean the same thing across cultures. Good assessment requires us to slow down and ask, what does this mean for this person in this context at this time? Now, let's talk about response styles. So, response styles refers to how somebody answers assessment items. This matters because test results can be affected by the person's motivation, emotional state, reading level, trust, fatigue, fear, or misunderstanding. Some common response styles include social desirability, impression management, defensiveness, fake good responding, like pretending to be better than they actually are, or the opposite, fake bad responding, which sometimes we call malingering. There's random responding or acquiescence, just saying yes to many items. There's extreme responding, fatigue, misunderstanding the items. So let's just make this practical. If Ted Lasso takes a personality assessment while trying to look fine, he may underreport stress. He may answer in a way that matches the version of himself that he wants others to see: upbeat, capable, steady, optimistic, supportive. If Rue takes an assessment while angry, withdrawn, mandated, or disconnected from treatment, her responses might reflect hopelessness, mistrust, resistance, or emotional exhaustion. If Miles takes a personality assessment while overwhelmed by school pressure and identity conflict, his responses might reflect anxiety and self doubt more than stable personality. So when we interpret results, we need to ask, what was happening when this client took this assessment? Did they understand the questions? Did they feel safe being honest? Were they trying to present themselves in a certain way? Were they tired, distressed, intoxicated, ashamed, guarded, or pressured? Again, test taking is behavior. The result is not floating above context. It's produced by a real person in a real moment. So personality assessments are never culturally neutral. They are created by people, they use language, they reflect assumptions, and they're normed on particular groups. They ask questions that may or may not fit the client's life. So we need to think carefully about culture and development. Consider language and reading level. Does the client understand the items as intended? Consider cultural norms around emotion. In some families and cultures, direct emotional expression may be encouraged. In others, restraint may be valued. A test may interpret restraint as emotional distance when it may actually reflect cultural training, safety, or respect. Consider family and community identity. Some clients understand the self as deeply relational. Others have been taught to think about identity in highly individual terms. A personality tool built around individual preference may miss relational, communal, or spiritual dimensions of self. And consider gender expectations. A boy who has been punished for vulnerability may appear emotionally detached. A girl who has been expected to care for everyone may appear highly agreeable or helper-oriented. Is this personality, socialization, survival, or all of the above? We also want to consider disability and neurodivergence. A client may answer items differently because of sensory needs, executive functioning, communication styles, masking, fatigue, or previous experiences of being misunderstood. Also, we want to consider adolescence. Adolescents are still developing identity, emotional regulation, autonomy, peer relationships, and self-understanding. Their personality results may reflect a moving developmental process, not a fixed identity. And this is especially important when we think about characters like Rue and Miles. Rue's presentation cannot be separated from adolescent development, substance use, depression, trauma, family context, and identity. Miles' presentation cannot be separated from adolescence, cultural identity, family expectations, school pressure, and mentor relationships. And the DSM-5TR is also a reminder that diagnostic and assessment language changes over time. The APA describes the DSM-5TR as the current standard classification for mental health professionals in the United States. Even our major diagnostic systems evolve, which should keep us humble. Personality assessment should never pretend that culture, development, and systems are background noise. They are all part of the assessment. So here's a simple framework for using personality assessment results. What fits? What's missing? What else should we assess? And again, let's use Ted Lasso to apply this. What fits? The ENFJ and the type 2 descriptions fit his relational focus, emotional attunement, values-driven leadership, and helper identity. What's missing? Divorce, panic, grief, relocation, masculinity, loneliness. What else should we assess? Panic symptoms, mood, sleep, support, risk, coping, substance use, family history, attachment patterns, and emotional avoidance. Personality assessment is one piece of the picture, not the whole person. So let's close with this. Personality assessments are mirrors, not cages. They can reflect patterns, language, strength, and growth areas. They can help a client say, ooh, that sounds like me. They can help a counselor say, that gives us a possible pathway to explore. They can help people talk about needs, conflict, coping, motivation, relationships, and stress. But personality assessments can also distort. They can distort when we forget reliability and validity. They can distort when we ignore culture and development. They can distort when we confuse state with trait. They can distort when we treat popular tools as diagnostic tools. They can distort when we use labels and explain away pain. So when we look at personality assessment results, we want to ask what fits, what helps, what might be missing, what could the harm be if we overbelieve this, and what else do we need to understand? This is especially important this week because your assignment also asks you to evaluate personality results for a fictional client using MBTI and Enneagram frameworks. The prompt asks you to think critically about how well the results fit, what seems helpful, what may be overlooked, and how counselors should use these tools with caution, especially around reliability, validity, culture, developmental differences, and trait versus state. So, as you complete that work, do not simply say this type fits or this type does not fit. Think like a counselor. Ask what the results illuminate and what they obscure. Ask how the client might experience the label. Ask what symptoms, identities, histories, context, and systems are missing from the personality description. And most importantly, ask how you would use the information ethically in counseling. Use personality tools to deepen curiosity, not shrink the client.